Alright, I'm going to do hand hygiene for 20 seconds. Hi, Mr. Doe. My name is Brandon. I'm your nurse for today. May you have your name and date of birth. Alright, I'll take a look at your wristband to make sure it matches. And I do see that it does match. So today I'm going to be changing the dressing on your central venous access device. It's the IV that the doctor put into your chest. Have you had this done before? Yes? Okay, so today I'll be removing the old one, cleaning the site, and putting on a new dressing. The dressing needs to be changed every 7 days to prevent infection. It's changed even sooner when it looks so saturated. I don't need any doctor's orders to have this done, so I'll go ahead and do it now. The procedure is supposed to be quick and painless. So if you have any, let me know. Do you have any question or concern? No? Alright. So first, do you have any allergies? Specifically to chlorhexidine, tape, or latex? No? Alright. Do you have any pain before we start? No? Alright. I'm going to put on my clean gloves and clean my table and prep my kit. I'm going to wipe my table for 30 seconds. Alright, the table's now dry. I'm going to let it now clean. I'm going to let it dry for 2 minutes. Do 20 seconds of hand hygiene. It's now dry. I'm going to bring over my supplies. Do hand hygiene. I'm going to open up my kit. Do hand hygiene again. I'm going to pick up my mask and my sterile gloves. And drop in my pipe patch. Alright, blue sides up, this is good. Do hand hygiene. Alright, Mr. Doe, we're going to get started on the procedure soon. Is this a comfortable position for you? Alright. For this procedure, I need you to be wearing a mask. Is it alright if I place one on you? Alright, thank you. I'm going to do hand hygiene for 20 seconds. Put on your mask. And I'll also ask that you turn your head to the left so that we can prevent any risk of contamination on the central line if you accidentally cough or sneeze during this procedure. Is that alright with you? I'm going to do. Thank you. And now I'm going to lower your gown so I can gain access to the site. Is that alright? Thank you. I'm also wearing a mask, so we're all good to go. I'm going to get started on removing your old dressing. I'm going to do 20 seconds of hand hygiene. Put on some gloves. Okay, so this may be a little sticky, so let me know if you have any pain. I'll try to be as gentle as possible and make sure not to press on the insertion site or tug the line. I'll stabilize the tubing. I'll take off the dressing to make sure it doesn't move, okay? So do let me know if you have any pain. I'm going to get started now. Now I'm going to remove the bile patch. Alright, now I'm going to take a moment to assess the site. But first, Mr. Doe, did you experience any pain or discomfort while I was doing that? No? Alright, so first I see that there's no redness, there's no swelling, no sign of infection. The tubing has no cracks or leakage, and there's no drainage. The tube is still the same length, 21 centimeters, which matches the previous documentation, indicating that it has not been dislodged. I see that it's clamped and capped, which is good because it prevents air embolism and blood leakage. Now I'm going to get started on cleaning the site. I'm going to do 20 seconds of hand hygiene. Now I'm going to don my sterile gloves. Now I'm going to organize my tray. All right. Now I'm going to get started on cleaning the sites for 30 seconds. I'm going to clean a 2-inch border around the insertion site, okay, for 30 seconds. I'm going to crack this. I'm going to get started. And now I'm going to clean the IV 3 times. Alright, now I'm going to let it dry for 30 seconds. Are you feeling alright, Mr. Doe? Alright, that's good to hear. I'm just going to let the chlorhexidine dry for 30 seconds. Just hang in with me. Alright, it's now been dry for 30 seconds. I'm going to grab a bio pouch. And now I'm going to grab a silver view. I'm going to try to get out as much of the air bubbles as I can. Right, now I'm going to grab pants. Right. Now I'm going to let this go. Try move more air bubbles. Right, now I'm going to date and time this. Actually, I'm going to put in tape first. Right, I'm going to use the butterfly method. Right, now I'm going to date and time this. I'll put it as today's date is March 1st. For my initials, it is 5 p.m. All right. Put this down. Okay, now I'm going to put on a new hub guard. Throw this away. Alright. Throw that away. Throw this away. This too. Alright. I'm done with the procedure now, Mr. Doe, so we do hand hygiene. So feel free to face forward now. I'm going to help you with that. Alright, I'm going to take off your mask now. Is that alright? Alright. And put your gown back on. Do hand hygiene. So Mr. Doe, how do you feel after the procedure? Did you have any pain or discomfort? No? Alright. So I'm going to put the side rails up, bed to the lowest position, and call light is in reach. So now I'm going to start documenting, do hand hygiene. So now I'm going to document of March 1st at 5 p.m. of the procedure. My assessment of the site, there's no redness, no swelling, no leakage, there's no cracked tubing. And then the length of the tubing is 21 centimeters. The patient tolerated the procedure very well and had no pain. Alright, do hand hygiene. Alright, Mr. Doe, that'll be all for me. Do you have any questions or concerns? No? Alright, I'll be going now. Thank you so much for helping.